We have a really exciting guest with us today. And if you've been part of our membership, if you followed us over on YouTube, of course, you probably will have seen Dr. Sharon Stills. And in fact, we were a part of that Menopause Transition Summit in September there. So wonderful information. And Dr. Stills, of course, led that whole charge, which is such a great thing you've got going on because I mean, I think we're all in the same boat where we think there isn't a lot of information online, although that's changing. I'm noticing that it's changing, which is fantastic, but that's due in part because women like you are speaking up and basically saying, hey, this doesn't have to be that dreaded time of life. In fact, this could be the sacred second act. And this is what I loved about you. When I found you, I'm like, yes, to all the things that you talked about. So we've invited Dr. Sharon to come back on today. She's going to talk about, I guess, the lowdown with hormones. And we're going to open up for a little Q&A at the end. So if you have questions, make sure that you save them, or you can drop them in the chat and we can ask them intermittently as well. But Dr. Sharon, welcome to Move Daily. Thanks for coming and joining us.
Oh, always fun to be here with you. And if I don't think I think when I share my screen, I don't see the chat. So if someone is asking a question and I'm going to be yapping away, if you want to interrupt me, you can totally do that.
Okay, you got it. I will.
But yes, it's wonderful to be here and wonderful to always collaborate with you because I think our work is so complementary and it takes a village to have a healthy body, and there's lots of different pieces that go into that. And so I love the movement piece you bring. It is so crucially important. And today we're going to talk about one of my favorite topics, which is hormones. And so I have a little PowerPoint that I put together, and I'm just going to go through it. And like I said, if you have questions, as long as it don't take me too off base, I'm happy to answer them. And we've got about an hour together, so we'll see what we get through.
Sure.
So let me just make sure I can advance my screen. So we're going to talk about the lowdown on hormones because there is, like Tracy said, there is a lot of information. And I think now that kind of Oprah and Gwyneth Paltrow and Michelle Obama and Drew Barrymore and these women in politics or in entertainment are going through menopause, they're bringing more awareness to it. And, that's super. We just always have to be careful about the information we're consuming. And just because we love someone as an actress doesn't mean they actually understand hormones or stuff. So it's great that it's getting out there. And that's not to say I haven't really dove deep into what they're saying yet. So I don't know, maybe they're saying some good stuff or maybe some not so good stuff or maybe part and part, but I've been practicing for over 21 years in the trenches, practicing bioidentical hormone replacement with women. And so I really have a deep, deep understanding of it, not just from the scientific perspective, but from the clinical perspective. And to me, that's the most important perspective, because a lot of times we can read something or see a study, or we can read it in a physiology book and it sounds really good, but then it doesn't really play out that way in real life and in our bodies. And so it's really important that we are looking at what's actually going on. And then if we can couple it with the science and back it with, facts, then that's even better. So that's what we're going to do today. We're going to talk about some science. We're going to talk about some clinical stuff, and we're going to put it all together and hopefully answer any questions you have about hormones, because there's a few big questions I hear. So one of them is it safe? Is it going to cause cancer? I heard it causes cancer. I'll tell you the answer to that is no. We'll get into that. One of them that I hear, is it too late? I'm already 65 and I didn't do hormones. And so it's never too late. It's better to start earlier, but you can still grab some benefits no matter when you start. And then the other question I hear a lot is, how long do I have to take them for?
Right.
And The answer to that is for as long as you want to be practicing preventative medicine and supporting your brain and your bones and your breasts and your heart and all the systems in your body. Because as we go through menopause, it is not a disease to lose our hormones. It is a natural process in life as a woman going through this natural transition. But the thing is, we don't die like our ancestors did when we're 35 or 40. We are
Right.
biologically developed to live to, I'm going for 130, but I'd say at least 120. And so I certainly wouldn't want to live a half or 2/3 of my life without my hormones. And so those are
Don't
just
you
some,
say something like you're going to be buried with them?
I do say that. Yeah, and I want to be cremated, but if I get buried, I want to be buried with them just in case. I want to have them on hand. I don't want to be without them. That when I go, I just got back from a business trip. I was at a conference in Germany and visiting some of the clinics I work with over there and in Switzerland. And when I pack my bags, it's like the first, I'm like, all right, let's not forget the hormones. Let's pack them first. Let's make sure I have enough. I do not want to be gone for a couple of weeks and not have them with me.
Sure.
Okay, so I am yep, it works. Okay, so this is just, my why. Those are my two little grandbabies. Actually, that picture, I got to update that picture because we were just at that restaurant. It's our favorite restaurant in town. And we were just there on Saturday night. And so now I have a new picture of them sitting together. But I think it's important, that's me on the other side in Costa Rica under a waterfall in the hot springs. And I think it's just always important we remember why. Like, what's motivating us? For me, I want to be healthy and young so I can travel and enjoy my life because I'm a little bit of a travel junkie. And I want to be an inspiration to my grandbabies. I want to change the way the future generations view aging. And so my generation, my grandma was old. She wasn't, running around and jumping and climbing and doing all the sorts of stuff that I do with my grandbabies. And I want to be able to continue to do that. I don't want to have to say, I can't do that, girls. My knees are hurting, or I don't have energy. I want to be able to be active well into my later years. And so I think just always having a why when we wake up, why is this day going to be amazing? How can I be of service? What do I want to flow through me? How am I co-creating with the universe? I think these things have to underlie everything that we do. We're so focused on, what's the pill, how much estrogen, and those things are important too. I did a webinar the other day with Gina Bria. We're hosting a retreat together, and it's all about ritual and nourishing and rest. And she mentioned a chia seed pudding recipe, and like the questions about the chia seed recipe, just like they wouldn't stop. It's just like, how many tablespoons? Can I eat it at night? Can I eat in the morning? What time should I eat it? And I'm trying to say, like, breathe and relax. And I think that's just what we tend to do. And
Right.
so
We want the formula. We just
yeah.
kind of give us the formula. And if we could just follow the formula, we're going to be better. But what you're saying is that there's just so much more incorporated in that, and having that why, can really pull you through those times when you're not motivated or you lack direction or any of those things, right?
Yeah, and it's why we're here and having that full human experience. And so yes, our supplements are important, our hormones are important, but our soul, our journey, our emotions, to me, that is the most important. So, and they're just so cute. So we're going to talk about a few different things, mainly about hormones today, and why it's not just a fix for symptoms, but a priority in the prevention of chronic illness and a healthy aging process. I think that's a real important point, that yes, if you're hot flashing and not sleeping and mood swinging and weight gaining and all these things, yes, it's nice to have hormone balance and have your physical body be able to exhale and feel good. But that's not the driving point behind hormone replacement. The driving point is all the things it does for you in the long run for all those systems in your body. You're preventing Alzheimer's, preventing breast cancer, preventing cardiovascular disease, preventing osteoporosis, some of the really big chronic illnesses, preventing autoimmune disease, all of these things. The proper hormone balance can really be a nice contributing factor in your healthcare plan.
Yeah, and that was a big insight for me, because I before I dove into this, I really just thought it was about managing your vasomotor symptoms, right? Like I didn't even think how much it impacted our future and our longevity. But I'm so glad that you're addressing that, because that then becomes critical, right? And more profound if you want to live longer, and if you want to live longer well, then these things are important.
Yeah. And honestly, when I first started with them, I didn't realize that either. I was like, well, it's got to be more to this. And there really is a lot more. And so, of course, the symptom relief is nice. We don't want to. And I was just listening to a conversation or an interview the other day, and the doctor was talking about how when you have more vasomotor symptoms, which is, well, hot flashes, so higher incident of hot flashes, more severity, was correlated with a higher incident of Alzheimer's disease and dementia. But to me, it's like, well, yeah, but you're having the hot flashes because your estrogen is low. And so it just goes back to, replacing the estrogen takes it. To me, the symptom is the body saying, hello out there, I'm drowning in here. I need some more estrogen. And so when we get rid of the symptom, we also then get the benefits. And so we know that dementia, Alzheimer's, higher incidence, again, post-menopausal, when our estrogen is dropping. And we know that estrogen is anti-inflammatory and neuroprotective for the brain, as is progesterone and even testosterone. So we're going to talk about a few different things. We might not talk about every single thing, but I'm going to do my best to kind of go over the highlights. So, these are just some symptoms I wrote down, and honestly, I could fill up, a bunch more slides. There's probably about 120 symptoms associated with hormone imbalances, and some of them you think of right away, probably sexless nights, low libido, hot flashes, anxiety, depression, but also urinary tract infections, joint pain, fatigue, migraines, hair loss. They're really, burning mouth syndrome. They're really across the board. And so, especially when you're in this perimenopausal, 40s and above, sometimes even late 30s, if something's going on, it always is worthwhile to say, are my hormones are involved? Because typically they are. And I find with any kind of emotional unrest, that I say in my red deck on my hormone card, it says like balanced hormones equals sanity. Because if you're not quite feeling right, there's probably a hormone or a connection to a neurotransmitter and when I say hormones and we're talking about menopause, obviously we're talking about progesterone and estrogen and testosterone, but I'm also talking about adrenal hormones and thyroid hormones and oxytocin and pregnenolone and DHEA, and vitamin D is a hormone, and parathyroid hormone and insulin and cortisol and leptin and ghrelin. There are a lot of hormones. So it's not just the progesterone, estrogen, testosterone, although those are very, very important and are what are usually cliff diving when we're going through menopause. But these other hormones are playing a role as well, especially like thyroid, adrenal. I see a lot of implications with the thyroids and the adrenals when a woman's going through this transition.
Yeah.
So our tribe is big. By 2030, which is almost, only 6 years away, 1.2 billion women. That's like mind-blowing, right? And so I'm really, really passionate about, we are not having our mothers or their mothers menopause. And a lot of us, like my mom, she didn't even she had a hysterectomy because she was bleeding heavy.
Didn't
Right?
they just hand those out like?
Yeah. Yeah.
You get a hysterectomy. You get a, like my mom too. Yeah.
Exactly. And knowing what I know now as a physician, I was like, oh, my mom just needed some progesterone. But that's not
No,
how it went back then.
no, I
And
know.
so we don't, because I think we're just kind of trained to think, oh, well, this is what happened with my mom or my auntie or my older sister or my grandma. This is what's going to happen for me. And I'm here to tell you, no, like if you eat differently, if you balance your hormones, if you do all these things, if you move daily, then you can have a very different experience. I had a very different experience than my mom did, and that we can really change this belief that menopause is the beginning of the end, and that we're old and we don't matter, and the best years of our lives are behind us. And I call like BS on that. You know, the best years of our lives, I mean, I think the best moments are always the moments we're having and that we're having right now, but that really that we reframe aging and really look at it as a privilege and an opportunity, because not everyone gets to age, and that if we are aging, we are very fortunate. And it's I used to say I was an anti-aging doc, right? I practiced anti-aging medicine, and I've since I started running my menopause summits and
Yeah.
really diving deep into this work, I changed that. I like had my team change all my bios and to say I'm pro-aging, because I'm
Yeah.
not anti-aging.
Yeah.
You,
Yeah.
how could you be anti something that is happening to every human being? Like
Right. Actually,
every
yeah.
moment we're getting older and older and older, and there's nothing we can change about that, but we can change the way we experience it. We can change the quantity, but not only the quantity, we can change the quality, which is really what I'm interested in. And so I love
Live,
aging.
yeah. Live
And
longer, healthier, better. Yeah, that's exactly what I want too.
yeah,
Yeah.
and I don't know. I don't usually watch reality TV, but did you see they have the Golden Bachelor on?
Yeah.
That show's got
I
to be.
didn't get sucked into that one, but I have
I
watched
I
it
got I
before.
got sucked in.
Yeah.
It's like the stupidest show ever. But what I wanted to watch,
Yeah.
just because I was like, these are women, you know, our age.
Yeah.
You have to be
Sure.
60 and above to be on the
Yeah.
show. And
Okay.
what I noticed, and what people are noticing, is that these women, they're like, they've all made these lifelong friendships. They were supportive of each other.
Yeah.
They weren't catty with each other, much
Yeah.
different to what I hear like goes on the regular show where there's 20 and 30-year-olds. And that is like, that is the beauty of getting older and coming into yourself and being wiser and realizing you don't have to put another woman down to make yourself feel higher. We can all support each other. There's enough room in the sandbox for us all to play. And so these are really important. And if you're listening and you're like, yeah, it sounds nice, Dr. Stills, but I'm not there, that's okay. You know, just like let this be a seed and maybe jot down, you know, maybe this is an area I need to explore how I'm feeling about this. You know, it's not something you have to change or feel bad if you don't think that way, but these are
Yeah.
interesting viewpoints that I would love for you to contemplate if they're not already something you own in yourself. So this slide I could teach on. I sometimes do to
Yeah.
other physicians for 4-day weekends. So what I will say here is that I am a terrain-based medicine physician. I don't believe in, oh, I have a bacteria, take an antibiotic and kill the bacteria, or, oh, I have a tumor, let's chemo the heck out of it. I believe in there is a terrain, there is a body, and this is a not only a physical terrain, but an emotional, a mental, a spiritual terrain. And that when our terrain is out of balance, it allows for disease processes, or whether it be tumor cells or autoimmunity or viruses, to set up shop. It's more hospitable for disease to set in. And so when I am looking at someone, when I'm working with a patient, it's not just about you need these hormones. It's
Yeah.
about what's going on in all these
What's the
issues.
story? Yeah, I like that. That's very vast.
So disturbance foci might be a term you've never heard of. That's a term from my work over in Europe. And disturbance foci are just what's blocking the body, what's blocking the flow, the fascia, the lymphatics, the energetics. These can be scars in the body. A lot of disturbance foci happen in the mouth. It could be root canals. It could be infections in the jaw, which are known as cavitations. It could be amalgams. It could be periodontal disease. It could be a lot of different metals in your mouth causing galvanic currents. But there's a lot that goes on in the mouth that affects our whole body. Our mitochondria, hormones are made in the outer membrane of the mitochondria. So we have to have good mitochondrial function to have good hormones and balance and energy. Our pH needs to be balanced. And we've all heard a lot about alkalinity. But there are certain areas of the body like our stomach and our vaginal canal, which actually need to be acidic. And so it's not just about being alkaline through and through. And our stomach needs to be acidic so that our alkaline digestive processes can actually happen. So we need to be able to have drainage. So when I'm working with a woman balancing her hormones, we're looking at bile flow. We're looking at how often she's pooping. We're looking at liver health. We're looking at lymphatic health. We're looking at the fascial constrictions or hopefully no constrictions. So we're looking at the kidneys and the lungs. We're looking at that all the organs are draining and excreting because hormones get excreted through bile, through our bowel movements. So it's really important that things are flowing. Trauma is a big one. If we have emotional trauma, which most of us do, hard to escape that one and have a perfect childhood. So, we have to address the emotional piece, our toxicity levels. That's another one. If you're alive today, you're toxic. It's just a matter of how toxic, what are the toxins, and how is your body able, are they overloading you or is your body able to keep up with it? So these are just, there's other ones here, but nutrients, but just to give you an idea that there are a lot of things that affect your health and affect your hormonal health. So even though I go on and on and on about how amazing hormones are, because they are, I'm always looking at all of this hydration. So there's just a lot of pieces that go with hormones. And this is not like, wait, I didn't get that one. It's just to kind of, again, give you a thought process of like, oh, terrain-based medicine, it's all connected. I never understood in mainstream medicine how if you go to, say, the cardiologist and you're like, could you look at my ear? They're like, oh, no, you'll have to go see the ENT doctor for that. If you come to see me, I'm like, sure, we can look in your ear because your ear is connected. It's all connected.
Right. If someone were to go to a physician or looking for a doctor and they said, I'm looking for someone who's terrain-based, is that a common phraseology? Is that your phrase? I love it. I love that concept, but yeah, I'm just wondering if we're looking for someone.
Common. I wouldn't say it was common. I would ask them if they've ever heard of European biological medicine or bioregulatory medicine, because that's where I learned this, studying over in Switzerland and Europe. I would ask them, do you know what terrain-based means? Do you have a terrain-based philosophy?
Right. They may call it something different, but it's that sort of holistic approach or all-inclusive I love that. I feel like most GPs are not doing that. And that's what's like you go in, right? And so
no, they're not.
That's where you're seeing a naturopath and you're getting that wider scope as part of your.
And even, unfortunately, you got to do your due diligence even within my profession these days, which makes me very sad. But a lot of naturopaths still are practicing, I call it like green allopathy. So maybe they'll give you an herb instead of an antibiotic, at least for the first round, but they're not thinking broadly about your whole terrain. So this is probably my favorite slide I've ever made. Take a screenshot. So I just love this. It just goes back to how are you nourishing yourself and not just being so angst about When is she going to get to the hormones? Do I take 3 milligrams or do I take 4 milligrams? Like those are the easy details, but the nourishing yourself is a little more, can be a little bit more challenging. And again, is really important. And where maybe you were really good, you nourish yourself and you spend a lot of time with family, or maybe you're always in nature, but are you like getting all the different pieces of nourishment, movement? Where could you, I'm assuming you're here, you move daily, or you're part of Tracy's crew, but maybe you need to connect more with the people in your life, or with an Anna furry friend, or whatever it is, but just to always be thinking about, how can I nourish myself? And so my apple and orange, which I started saying apples and monkeys because I heard someone say that somewhere and I thought it was funny, because I was like, that really is like a different thing. Apple and orange is still fruit. But when I'm talking about hormones, I'm always talking about bioidentical, unless I have something negative to say. And then I'll usually say synthetic hormones, because synthetic hormones are apples and oranges, apples and monkeys, totally different than what bioidenticals are. Bioidenticals are biologically identical. They are formulated and the chemical expression is the same as what your body was producing. So if estrogen looked like this when your body produces it, when we give you bioidentical from the compounding pharmacy, it looks like this. If you were to take a synthetic estrogen, it might look like this. So it's a very different chemical structure and has different, if your body, if the receptor site is used to estrogen looking like this, and then it comes and it docks on the receptor site, it understands what that is. But if it's a synthetic that looks like this and it gets to this receptor site, your body gets very confused and we start to have a lot of side effects, because the synthetic estrogens are not what we're used to producing. So I don't always say bioidentical hormones, but
you always mean that.
I'm saying it now.
Yeah.
So this is a nice little chart just showing I always say hormones are a symphony, and this kind of shows the symphony to a degree. And you wouldn't go to the symphony and just want to hear the percussion. You want to hear the jazz and the woodwind instruments and the strings, and that's what makes a beautiful symphony. And so it can be dangerous when someone just throws some estrogen at you, or just throws some progesterone at you, and doesn't really understand that so these arrows, this goes to this, which goes to this, which goes to this, and this can go to this, but it can also go back to this. And so there's a lot of interactions. And cholesterol, so I feel like cholesterol and estrogen are probably like two molecules in our body that have just I don't know why they're like got outcast. They're like the black sheep. We hate cholesterol. And I think part of that is just the pharmaceutical companies love selling cholesterol lowering medications. It's I don't know, gazillion $billion industry. And the truth is, cholesterol, a healthy cholesterol used to be 300, but you can't sell as many pharmaceuticals to lower it if people are at 200. Right. So what they've done over the years, they've done this with blood sugar, they've done this with blood pressure, they've probably done it with other things that I'm not even aware of. They just keep lowering what the norm is, so then you can prescribe medication. And so lots of women and men come to my practice and they're very concerned. I do like 30 tubes of blood. And they're like, what's my cholesterol level? We're all very fixated on that. And I often am much more concerned about a low cholesterol level than I am about a high cholesterol level. And so you can see here, cholesterol is like the grand poobah of hormone production. We have to have cholesterol. We have to have cholesterol to make pregnenolone, which then goes down into all the pathways and makes our estrogens and our DHEA and our progesterone and our testosterone. And so when we drive our cholesterol down, we're kind of stopping this whole process from happening. So we just need to rethink our cholesterol game and not be so afraid of it. Cholesterol forms the fluidity of the cell walls. It lets good things get in and bad things get out. And so cholesterol is not as bad as we've been led to believe. And so once it turns into pregnenolone, then we have some options. And I'm not going to go over all of this, but pregnenolone goes to progesterone, and progesterone goes to glucocorticoids. And glucocorticoids are stress hormones. So if you are very stressed out, I often say, if you've heard me speak before, stress is 99.9999999% of all our issues and plays a role in all disease processes. So if you're really stressed out, you're just pulling all your progesterone into stress hormones, and then you're going to have a progesterone deficiency. And progesterone deficiency is rampant. And without progesterone, we don't have the balancing effects of our estrogens. And so then we can have estrogen dominance, which causes overgrowth, because estrogen is like grow. So we can have proliferation of tissues, our uterine lining, and so forth. Without progesterone, we can have water retention and gain weight. Progesterone is nature's Ambien or nature's Valium or nature's Xanax. And so we can have mood swings. We can be anxious. We won't be sleeping. It affects our bones. It affects our brains. It affects our breasts. So it's just a way to show you, like, it really, the knee bone really is connected to the hip bone, and stress really does play a role in your hormone balance. And then, of course, on the other side, pregnenolone can go into DHEA, and DHEA can go into testosterone. And this is one of those where sometimes women are told, you don't need to take testosterone. I'm just going to give you DHEA because it turns into testosterone. And that's not something I see. Like, that's something you read or you might have heard, but it's not what I see. Like, I'd say 9 out of 10 women's don't take enough of they need their DHEA for other things, and they don't push it down the pathway. So actually, a lot of women do need actual testosterone replacement. They just don't need ginormous amounts like a man would need, but it does. And testosterone, good for sex drive. We all think about that, but good for bone health, good for breast health, good for brain health, good for cardiovascular health, good for dopamine production and giving us motivation. So there's a lot of benefits. Testosterone's kind of been put in the sex drive, and sex drive is important and it can help with that too, but there's a lot more to the testosterone story. And then we have the estrogens, and there are different kinds of estrogens. So we have estrone, which is E1, which is what's produced if we're carrying around too much fat. We'll produce estrone out in our fat cells, and that's a very inflammatory estrogen. It's not the one we want. We also have E2, which is estradiol, and you could see these two go back and forth between each other. Having adequate amounts of iodine will help it stay with estradiol, which is more beneficial. Estradiol is the estrogen that really helps with the brain and the cardiovascular system. And so we get a lot of prevention from estradiol, but it really needs to be balanced with estriol, which is anti-inflammatory, hits the beta receptor sites as opposed to the alpha ones, which are proliferative instead of inhibitory. And so what I'm prescribing in practice is a combination of the two of these, known as biased. You may have heard that term before. And so it means the
two of estradiol and estriol, those two are combined?
Yes. Okay. And usually it's a typical dose is like 80-20, 80 estriol, 20 estradiol, but it's very individualized. And by doing testing, I can see some women need more, some women need less. And then these are some of the metabolites that the estrogens break down to. And these are very important as well, because some of these are protective. 2-methoxyestradiol, I use that to treat breast cancer. It's an estrogen, but it actually treats breast cancer. The pharmaceutical companies are trying to hijack it and turn it into a patented pharmaceutical that they can use. So it's very important when someone says estrogen causes breast cancer. Well, you can see it is a whole spider web. And to say estrogen causes breast cancer, well, then every girl going through puberty and getting surges of estrogen, we'd be seeing surges of breast cancer diagnoses. And thank God we don't. We see the breast cancer diagnoses postmenopausal when all these levels are dropping. So it's really important if you're going to do hormone replacement that you do 24-hour urine testing, which is what I make all my patients do, that these are being monitored and that the right steps are being implemented if you're producing too much of the wrong kind of estrogen or the wrong kind of metabolite. But this is
sorry.
No,
I'm
it's okay.
sorry. I was just gonna say, is there a right time to go for this testing, or is there a time where you're like, oh, let's just wait a little bit, you're on birth control, or you're doing this or that, or you're not fully menopausal yet? Is there a right time to go for this testing?
If you're on, that's a good question because that comes up a lot. If you're on hormones, like say you're currently on some hormones and you feel pretty good on them and you just want to know if they're the right ones for you, then do the test. And I can say, okay, these are the right hormones for you as far as this goes, but this, you need to tweak this, or these are totally bad for you, or these are fantastic for you. If you are perimenopausal and you want to know, then yes, it's good. But I usually have people like check with me. If you're not getting a period, you can do it anytime. If you're still getting a period, typically I want to do it like day 19 to 21. Sometimes I do it a little earlier. If your cycles are super irregular, it just depends.
Yeah.
I don't like people to spend a lot of money on a test and then it doesn't give me results that are going to help me go left or right. So if you haven't had a period and you're menopausal, you can do it anytime you want. And if you're on hormones and you're like, I'm on synthetic hormones and I want to get off of them, then I say stop them, let them wash out of your body, wait a good 6-8 weeks just to be sure, and then do the test to get a baseline.
All right. Okay. Good.
So I'm not going to belabor this, but this is about the women's health, the WHI study that, kind of changed the trajectory of women having access to hormones and really was not a well evaluated study, and it's since been debunked and gone over lots of time. And the one thing that I was just pulling out here is that the research that this Dr. Ragaz did showed that the women who were in the estrogen only arm, and remember the WHI study was with synthetic hormones, and these are like not good hormones. These, in my opinion, do cause cancer, can contribute to cancer. But the women who weren't taking the synthetic progestin, which is the synthetic progesterone, and were just taking the synthetic estrogen, which it's from horses, it has estrogens in it that we don't even have in our bodies, they still had a breast cancer reduction by 32%. And so that kind of blows my mind because I'm like, they weren't even taking safe estrogen. But so that whole study just really was a whole debacle and really messed up. And so shouldn't be what we're basing our decisions on.
I've heard quite a few doctors, but bringing that study up now. It sounds like enough people are basically saying that it was debunked, and let's move on from that and get the new research forward and talk about that instead. So that's good.
Yeah, exactly. Yeah, I know. I think so many women got harmed by their doctors just yanking hormones, and hormones getting this really bad rap. And yes, we are now, I think the tide is swinging where enough of us are speaking out and people are starting to listen. So this is just talking about estrogen and all. And again, it has over 400 important functions in the body. And I just pulled out a handful. But some of them, you could see it decreases plaque accumulation. It reduces the risk of cataracts. It improves our insulin sensitivity, stimulates the production of choline acetyltransferase. So that's where we get the protection from Alzheimer's. Our bone density can help reduce homocysteine, lowers levels of ACE2 in the heart. So I think that played a role with women in COVID in a positive way. All my patients who are on hormone replacement, we didn't have, I had no hospitalizations, thank God, no deaths. So I think that played a huge role, helps with magnesium uptake. It's connected to serotonin, which is our happy hormone, enhances sleep, feeling of satiation. So it stimulates cholecystic kinase in the gut. So it does, again, I just wanted to like have this up here to show you, oh, wow, does a whole lot of things, because normally we just think of estrogen and we think of, curves, and I don't want to have hot flashes. But hormones are, that's why I say they're really impacting every major system and minor in our bodies. And so it's not just about stopping the hot flashes. To me, that's like a nice side effect you get.
Yeah.
So estriol was that E3, the one that I said is part of the bias that I prescribe. And that's the one that hits the beta receptors. That's the one that is more inhibitory, anti-inflammatory. And so you could see here, it actually has anti-carcinogenic activity, and it doesn't cause hyperplasia. So hyperplasia is tissue growth. And so that's the whole thing when we say estrogen causes hyperplasia. And so now we're going to have breast tumors growing or uterine growth, and we're going to have cancer. But estriol doesn't do that, even when it's not when it's unopposed. So a part of the thing with estrogen causing that growth is when it's not balanced with progesterone. So a lot of old school doctors thinking you had a hysterectomy, so you don't need progesterone. That's like, no, but we need progesterone for all the other things in our body. And so they give estrogen unopposed, and then it can cause hyperplasia. So estriol, there's actually a quotient in the testing I do that looks at the amount of estriol compared to so estriol's E3 compared to your E1 and E2. And the higher it is, the more protected you are against breast cancer. So estriol is something I use in active breast cancer treatment with patients. And it's really a safe estrogen. It also helps, remember I said the vaginal canal should be acidic like the stomach. So it helps to establish that more acidic environment. So if you're having painful sex, if you're having bad vaginal dryness, if you're having a lot of urinary tract infections, internal estriol can really turn that around for the good.
We had a pelvic floor physiotherapist come on, and she just said exactly what you just said. So that's good.
When I was in Germany, I found this, side note, I found this chair that I want to put in my new clinic, and it's magnetic field for the pelvic floor. And you sit on it and it just does like all sorts of stimulation to your pelvic floor. It was quite a fun find.
Sounds titillating. Oh my goodness.
I was like, oh, I'm gonna need to put this in a quiet room, private room. So
by oneself.
So estriol also, for immune, like I said, hormones help our immune. So estriol boosts your immune function. It enhances the activity of phagocytes, which are like the Pac-Man that come in and eat up viruses and bacteria. And so again, just showing there's a lot of connection with our hormones and all the systems of our body. Really, really important. Oh, here. So this is the quotient. You take estriol divided by estrone plus estradiol, and it gives you your estrogen quotient. And this is something that it can't be really figured out in blood because the blood levels aren't accurate. So it's something that when you do 24-hour urine testing, the lab that I use figures that out for you.
Yeah.
So I mentioned before about the receptors. So there are different estrogen receptors, and that's what I was saying, like the alpha receptors that the estrone or the estradiol hit are promoting proliferation, which is growth. Excuse me. And then the beta ones, which is what the E3, the estriol hit, is inhibiting that proliferation. And the research shows that estradiol, E2, does both equally. So when I'm giving biased, we're really getting that inhibitory effect. And we're still able to get the benefits from what the estradiol does. And the horse estrogens, so those are the synthetic hormones, they block the beta ones, which are the good ones, and they stimulate the alpha ones. And so they also, this 4-hydroxyequilinine is only found in horse urine. It induces DNA damage. So you can see where when you're using these synthetics, then we're getting into risky area. And they use, Premarin is from pregnant mare urine, like pregnant mare horse urine. The estrogens that they're using from the pregnant horses, I found this like so interesting, sad, and crazy, aren't even present in non-pregnant horses. So it's like even a non-pregnant horse wouldn't recognize or know what to do with those pregnant horse urine estrogens. And then we're putting them in our bodies when we're using synthetic hormones. And that's kind of scary. So I do get asked a lot. What's that?
I was just to say, do you know how long after the creation of like HRT did BHRT come along? Like how, like it was clear, surely someone basically said, okay, why are we doing this, putting horse hormones into our body? Let's create something that's a little bit more bioidentical. Like, was that quite a lot? Like, are they relatively new, or are they relatively old, or how long, how
So
long?
Dr. Jonathan Wright, who is, I call him the grandfather of bioidentical hormones, and a lot of people don't know about him anymore. He's winding down, but he is who I learned from, and he's the one who wrote the first prescription in the States for biased. So when I found that out, I was like, well, I'm going to go study with him because he seems to know what he's doing. So I don't know. I mean, it's got to be at least 30, 40 years. I mean, I've been doing this for 21 years and it was already happening when I graduated and went and got educated. So I'd have to look that up to give you an actual, it's a good question.
And I'd be interested too. I should ask Chat GPT just to see what they can come up with, but to see like what the percentage now, if this many women were using HRT and this many using BHRT, like has it shifted now that more information is coming out, or like I'm curious about that.
Yeah, that's part of the problem is a lot of women, if they're just going to see their OBGYN or their GP, they're not getting the access to the bioidenticals, or they're not getting, good facts and good data told to them, which is unfortunate.
Yeah.
So this is just a little bit about the gut, the liver, and lymph. And I know we're closing in on the hour. Are there questions?
Yeah, make sure you drop them in the chat. I've been looking at the chat. I don't see anything right now, but please feel free to drop drop a question there, and Dr. Stills can continue until I see one there. But yeah.
So this is again just going back to, like, I took out from that terrain base. These are some things that are really intimately your gut health, which is where we detoxify, where if we're producing too much beta-glucuronidase in our estrobolome, which is the portion of the microbiome that's responsible for estrogen metabolism, that you can have second passes and get re-exposed to estrogens rather than them being excreted. Your liver is really important for detoxification, for thyroid hormone T3, T4 is converted to T3 in our bile, which is from the liver and the gallbladder. Our lymphatic health is intimately related to our breasts, helps progesterone flow through the body, detoxification. So these are some real areas. If you're doing hormones, we want to make sure things are going smoothly there. And I think, with our microbiomes, we're just at the very beginning of really understanding what is going on there. So who, what, where, why, how. Here's our nice vagina picture we give to all our patients. It's really important where you want to be applying the hormones, the creams.
Show us the goods.
To the external labia, or labia majora can be called. This is wet, moist mucosal tissue. It's not into the vaginal canal, but it's right here. And that's so we don't get dermal fatigue. A lot of doctors tell you, rub it here, rub it on your breast, rub it on your stomach, and it starts getting congested and ending up in the fat cells. So by applying to mucosal tissue, we can get continued absorption, and I can use less and get just as much benefit from it.
Okay.
You never want to use oral estrogen for these numerous reasons. It definitely enhances your inflammatory response, so that's a good red flag. Doctor says they're a hormone expert and then wants to give you oral estrogen. You're like, I'm out of here. Bye. That's not safe. How often you have to apply varies. Usually estrogen and testosterone are done in the mornings. Progesterone is done at night. Sometimes estrogen is done again at night. It just really depends upon you, what you need, how you're responding, and so on and so forth. And then monitoring is really important. Once I have a patient who is situated on their hormones, and typically it's once a year, I have them do their hormone test just to check in. Sometimes things can change. It's for their safety. We want to be keeping an eye on those estrogen metabolites and so on and so forth. And then just to wind it up, as I said in the beginning, just to remember, progesterone, testosterone, did I not write estrogen? Well, I was talking about estrogen. I guess I didn't write estrogen here, but that these are the other musicians. Pregnenolone, which I showed you, that was the one that came from cholesterol. DHEA, prolactin, oxytocin, our bonding cuddle hormone, insulin, cortisol, aldosterone. That's another adrenal hormone, helps with fluid balance. Growth hormone, thyroid, calcitonin, vitamin D, melatonin, that there are many hormones that make the body sing and that we want to be paying attention to all of them. That's just a patient of mine. We skipped that.
Here's a quick question, Dr. Stills. Someone asks, if menopause happened at 52 years of age, is it too late to start at 57? You were saying it's never too late. So could you just allude, give us a little bit of coaching on why it's never too late and why it's still beneficial even 5 years after menopause?
Because you're still losing you're still having bone loss, you're still having things decline in the brain, and potentially arteries can be clogging, and breast tissue and heart tissue and immune function. So like, it's never too late to go in and start feeding those systems again. And maybe you don't have symptoms, so you've thought, I don't need hormones, but this is another way, like we said in the beginning, of looking at it, that you have prevention and that you're treating your whole terrain and your whole body. So it's never, ever too late.
Yeah, that's how I feel. Like, I don't have symptoms. And so initially I was like, well, there's no need. But again, once I learned about all the benefits of, longevity and all the things that I want health for, then it just became a no-brainer to me.
So, I'm, especially with hormones, you have to test. You can't just be like, oh, you really have to look. And so I just want to show you this real quick. This is what a hormone test looks like. It breaks down the different estrogens. It breaks down your ratios, your metabolites. It looks at, like this 4-hydroxyestrone. This metabolite of estrogen is known to cause DNA damage and is probably the most inflammatory metabolite. And you could see this just a fake test, not a real patient, but you could see like the reference range is 7%. And this one is at 9%. So this is someone I would be working with to make sure we're giving them the right nutrients, whether it be magnesium or sulforaphane or whatever they need, liver detox, methylation, to make sure that we're getting this number down so that the hormones they're taking are being utilized and beneficial and not going down inflammatory pathways. And then we get into all the androgens and the glucocorticoids, which are the stress hormones, and the mineral corticoids, which is your aldosterone. We're looking at thyroid, which I then also look at in the blood. We're looking at melatonin, oxytocin, growth hormone. So there's a lot of things we're looking at. You can see here, there's all these markers. I'm not sure what that red line is on the screen. I don't know where that came from. But so it's quite more complex than just looking at, which is why you can't use blood.
Right.
It just doesn't give you the whole story, and it can be very misleading.
Okay. There are just a few other questions, and we're going to wind up here, everyone. So if you do have a question, quickly drop it in the chat. Carol asks, if there is a history of breast cancer in the family, would a low dose of estrogen be appropriate together with progesterone and testosterone?
Yeah, so that's one of those myths that if there's a history of breast cancer, you can't have hormones, whether it's in your family or a personal history. And I think by not doing hormones, you leave yourself more open to a risk of potential cancer. So I think I said in the beginning, I have, whether it's an active cancer, post-cancer, worried about cancer, I'm doing what I'm doing here. I'm looking at your hormones, your urine, your history, your terrain, and prescribing appropriately, and really utilizing the benefits of the estriol, which is anti-cancer, and the 2-methoxyestradiol, which is the metabolite that's anti-cancer, that of course the FDA has tried to take away. So yes, you just got to be working with the right person, and you got to be monitored properly. You wouldn't just want someone throwing some hormones at you and not monitoring you.
What's the average? What's the monitoring look like? Is that every 6 months? Is it an appointment a couple times a year? What is that usually?
In the beginning, it just depends what your results look like and how you're doing. Ultimately, the goal is to get most of my patients
Figure
are
it out.
once a month. I mean, not once a month, once a year. Once a month would be ridiculous. Once a year. They have their yearly check, once
Okay.
you're post-menopause. Like, I have a lot of patients. Like I said, I've been doing this for 21 years. So I have a lot of long-term patients who have been with me 15, 18, 20 years. Those patients, like, I see them once a year. We've already handled everything. They're handled. You're postmenopausal. There's not that much change unless you have like something drastic go on. So it's just a once a year monitoring.
Yeah. And one other question here. Does it make a difference if I haven't had children, in terms of needing anything more or less? That's a good question because our hormones different.
So whether you've had children or not doesn't really make a difference. There's, when we're pregnant, we produce some higher levels of hormones that are protective and breastfeeding. But if you haven't done that, at the end of the day, when we're postmenopausal and we're losing our hormones, we all need them replaced, whether we've had children or not.
Yeah. Tell people where they can work with you, how they can find you, where they can work with you. I don't think that you can't work with Canadians, can you? Or can you? I can't remember what we
Yeah, I do 24-hour urine testing with my Canadian friends to the north.
Okay.
And then it just depends if they have someone there that they can get the hormones for. I'll tell them what they need, and it differs. Some patients have someone in the States and they can fly in or come see. It just really depends, but they can certainly do the urine testing and at least find out.
Sure.
And then if you have someone who's willing to work with you. So it just depends upon your situation. But I do have patients in Canada who have found some doctors that are willing to do what I say to do.
Good. And that's Dr. Sharon, Dr. Stills? What's your website again? Dr.
drstills.com.
drstills.com. And then you can also follow her over on Instagram at
Dr. Sharon Stills, right? Yeah.
Dr. Sharon Stills, yes. I'll post that actually on my story right now after this session. So you can always go to my story if you can't remember that. And of course, in the notes below, I'll share just where you can reach Dr. Stills as well. Thanks so much for joining us. And yes, this is something that we will continue learning about, as things change for your life, for your body. It's so important just to really find that good health professional that you are in concert with, and not just one person. I think we need, like you said at the start, we need a village to help us optimize our health. And that's what you helped us do today. So thank you so much. All right, everyone. Thanks for joining. We'll see you in the next coaching call. Bye-bye.